welcome to the webinar. For this webinar, we are very pleased to welcome two guest speakers, Nancy De Green and Thomas Blah. Nancy, she's a veterinarian working at the Federation of Veterinarians of Europe, the FVE. She is a member of the European Commission Task Force on Pig Castration and member of the European College of Animal Welfare and Behavioral Medicine. Thomas will be also here. He's a professor emeritus in epidemiology and president of the German Veterinary Association for Animal Welfare. So we invite you all to have a nice discussion, chat discussion, and now we will start with the PowerPoint presentation. This webinar is based on the results from a survey done by the FVE and collaborators. Nancy and Thomas are attending this webinar and will be available for the chat discussion. Unfortunately, Lotta Berg apologized for not being available today. Pig leg castration is one of the 3 hot items in pig welfare, together with tail docking and the welfare of powering sows. Many male piglets are surgically castrated to prevent boar taint and aggressions. This is usually done at a very young age by cutting through the scrotum and tearing out or cutting the spermatic cord. The EU legislation allows this to be done in the first 7 days without anesthesia and analgesia. The testes and scrotal skin are innervated with nociceptors. Prunier and collaborators found increases in plasma cortisol, ACTH, and lactate concentration in castrated piglets compared to the control group where piglets were only restrained. Castration without analgesia and anesthesia activate the hypothalamus pituitary axis and also the sympathetic axis. There is an increase in heart rate variability and there may be an alteration of the immune function. During surgical castration, increases in high frequencies vocalization may indicate visceral pain. Pain-related behavioral changes are observed during several days after surgical castration. Piglets are mature species. Their central nervous system is fully perceptive to painful stimuli from birth. Young animals perceive pain, but they may express pain in more subtle ways than adult animals. Facial expressions is one of the latest pain indicators in animals that allow a more sensitive identification of pain. Some anatomical structures are less developed in young animals, such as vocal cords, which may let difficult the identification of pain. Finally, pain stimuli at a young age produce a long-term sensitization of the central nervous system. This means that when getting older, animals that suffered pain when young are more sensitive to other types of painful situations. All of this raises concern about the welfare of very young pigs. In several countries, this led to societal pressure. Additionally, new insights and research is going on in this area, with the development of alternatives to surgical castration. To tackle this, in 2010, on the initiative of the EU Commission and the Belgian presidency, representatives of the European farmers, meat industry, retailers, scientists, veterinarians, represented by the Federation of Veterinarians of Europe and animal welfare non-governmental Organization agreed upon the European Declaration on Alternatives to Surgical Castration. The final goal of this declaration is to phase out the surgical castration of pigs this year, in 2018, in all EU countries. But the declaration also requested that from the 1st January 2012, surgical castration of pigs shall only be performed with prolonged anesthesia and/or analgesia. It is important to emphasize that this is a voluntary commitment. Several countries already agreed on deadline with respect to banning surgical castration without anesthesia and analgesia. Right now, in the near future, Germany will only allow surgical castration if done with anesthesia. No country, however, has set a deadline to completely phase out surgical castration. In some other countries, market pressure are increasingly present, such as in Belgium, where retailers only accept pig meat from non-castrated animals. In Denmark, next year, in 2019, they will start a voluntary analgesia and anesthesia through the Danish Pig Producer Quality Assurance Program. Producer will be able to perform the anesthesia and analgesia themselves after a training course of 8 hours. In this context, an online survey was designed by the FBE and agreed by the EU Commission. The survey was realized in 2015 and spread to experts in the field of pig welfare and production. In total, 24 countries participated in the survey and performed with the support of the FBE. From this survey is already published in an open access journal named the Porcine Health Management Journal. From this survey, it was estimated that 64% of pigs were castrated, surgically castrated. This table summarizes the percentages of pigs raised as entire males, as immunocastrated animals, and as surgical castrated animals in the 24 countries assessed by the survey. In the first column, you can see that entire male production is traditionally high in Spain, in Portugal, in Ireland, and in UK. Recently, the Netherlands has noticed a drastic increase in entire male production. France and Germany also increased the production of entire male up to now to 22%. Immunocastration, the second column, is still low, very low, but increasing. And there are some countries, such as Belgium, that are now immunocastrating 15% of the animals. When castration is performed surgically, only Norway, Sweden, and Switzerland do it with both anesthesia and analgesia. 6 other countries reported the use of analgesia only. Nowadays, there are 3 main alternatives to surgical castration developed. The first one is to follow with surgical castration with the anesthesia and post-op analgesia. So let's discuss this first alternative. Anesthesia can be injected locally. Lidocaine is by far the most common local anesthetic tested under experimental conditions. Lidocaine shows a good efficiency from an anesthetic point of view. 3 minutes after the injection of lidocaine, lidocaine is found in the spermatic cord. However, it is important to say that lidocaine does not easily diffuse into the cremaster muscle, which is also cut during the extraction of the testes. It is important to notice that lidocaine is not licensed in pigs in many countries. Procaine is licensed in pigs, but its efficiency is very questionable, and it takes much longer to become active, about 40 minutes. Also, to be effective, the use of local anesthesia should be done in a proper and professional way, which is not always easy. Anesthesia can also be performed by general anesthesia, induced by use of inhalation or injection. The most studied gas or inhalation anesthetic is the CO2, but the use of CO2 is very controversial. CO2 is shown to produce a strong aversion and irritations in adult pigs. In general anesthesia is not always good as anesthetic. The safety margins are narrow. It takes a long time to recover from the post-anesthesia for the piglets, which may increase crushing events depending on the system and their synchronized nursing behavior. Also, general anesthesia is very time-consuming and requires skillfulness. Also, there is a risk of disease transfer from building to building or from farm to farm with the inhalation machines. Finally, it should be emphasized that azaperon is a sedative. It is not an anesthetic. It makes piglets easier to handle. However, it is not effective at all in relieving pain. The most common class of analgesics, so analgesics should follow the anesthesia to prevent pain from during the recovery after surgery. And the most common class of analgesics used in food animals are NSAIDs, non-steroidal anti-inflammatory drugs, such as meloxicam, ketoprofen, and prunexin. Current NSAID products provide a reasonable margin of product safety. Additionally, the products are routinely applied through easy routes of administration. However, these products may reduce the time of wound healing after surgery. And also, there is still a lack of registration of analgesia products for pain mitigation in pigs. So overall, there is some studies using NSAID, and what we can summarize is the following. The vocalization results indicate that NSAIDs do not mitigate the acute pain associated with the procedure. Surgical castration with NSAIDs only associated with an increase in pre-weaning mortality and affects negatively growth rate and weaning body weight, compared with non-castrated animals. So NSAIDs are more likely to affect inflammatory pain stimuli that are transmitted as a consequence of the production of cytokines and prostaglandins. Benefits come from the reduction of inflammatory pain after the procedure. So the quality of the NSAID studies was rated as high by a review of O'Connor in 2014, but the panel of experts concluded that an insufficient number of outcomes had been evaluated for this intervention. Additionally, research and assessment of NSAIDs are needed for critical outcome likely to strengthen the evidence to formulate strong recommendations. Recent studies done by Guelph University have shown promising results using buprenorphine, which is an opioid. So as you can see in this graph, we have the black bars, which are castrated animals. So with different type of protocol of anesthesia and analgesia. So the first one is the use of buprenorphine with meloxicam and topic anesthesia, meloxicam and buprenorphine for the second bar. The third bar with the B is the meloxicam with topic anesthetic. The fourth bar is the buprenorphine with a topic anesthetic. And finally, the last one is the control group. So as you can see, whenever buprenorphine is used, there is a decrease in the expression of pain-related behaviors. However, buprenorphine is an opioid, which makes it very, very, very difficult to use under commercial conditions and almost unfeasible for the moment. To ensure an effective pain relief, anesthesia and analgesia are both needed. Analgesia alone is not enough. Enough time should be given for the substances to be used to become effective before doing the castration. The protocol should be practical on commercial conditions, and it should not be risky for the operators and should not enhance any disease transfer. Very few studies exist on the efficiency of the protocols on farm conditions. There is not recognized protocol, and some effective substances, such as lidocaine, are not licensed in pigs. Also, we have to consider the cost of administering this product, and also about who can administer this product at a farm level. Overall, this has a lot of drawbacks, and surgical castration with both anesthesia and analgesia is only performed in 5% of the EU piglets. Okay, so now one second, or maybe the first alternative to overall surgical castration is the raising of entire males. Production of entire males has many advantages from a performance point of view. It increases the feeding efficiency, the lean content, the polyunsaturated fatty acids, and reduce nitrogen excretion, and therefore everything reduces production costs. On the other side, production of entire males has many disadvantages. It is associated to an increase of aggressive behaviors and mountings, and therefore an increase of incidence of lesions in the carcasses. Also, of course, the production of entire male is associated to incidence of boar taint. So the raising of entire males improves welfare in early life. However, later in life, entire males perform much more aggressions, as you can see in this graph. So where entire males, severe lesions on entire males carcasses is compared with the percentages of carcasses of surgically castrated animals. So as you can see, it was a 0 compared to almost a 35% of entire males having severe lesions on the carcasses, as you can see on the picture. So yes, castration prevents mounting and fights and severe lesions. So entire male production requires reconsideration of the whole pork production system and innovation at all levels of the food chain to achieve high sustainability and product quality. Preventive measures to minimize the incidence of boar taint and aggressions should be implemented. So as we commented before, some countries already deal with entire male productions, such as UK, Ireland, Spain and Portugal. And recently, the Netherlands focused on the opted for the production of entire males too, with now having 65% of their pig production with entire males. And there is a significant increase of the production of entire males in other countries, such as France and Germany. Finally, it is important to know that the choice of entire male production will depend on the final product of the slaughterhouse's acceptance, the public acceptance, and the market pressure. The cost action e-payment, as you can see here, have a web page with a lot of information. This cost action is looking at alternative and innovative methods to achieve good production quality in entire males. e-payment aims to coordinate research to increase efficiency and knowledge gaps between different countries and between science and stakeholders. e-payment works through a totally multidisciplinary approach and includes 6 work packages. The first work package deals with breeding programs for meat production systems with entire males. The second work package focuses on national nutritional recommendations for feeding entire males. The third work package is looking at definition of entire male specific conditions for improved health and welfare. The work package 4 is dealing with innovation of grading and meat quality control systems. The fifth work package is looking at innovation in the processing industry, product development. And finally, the last work package is evaluating the consumer behavior and the development of specific information strategies. Okay, now we are in the third alternative to surgical castration, which is the immunocastration. So immunocastration is the process of immunizing the pig against the gonadotropin-releasing hormone by injecting an analog to this hormone, therefore inhibiting the testicular function. As you can see on the right side, we have testicles and prostates of an entire male, and below, testicle and prostates of immunocastrated males after the second injection. So this reduces the levels of androsterone and scator, which are responsible of birth taint. For the moment, the immunocastration is dealing with 2 injections in the neck of the animals. The first injection only primes the pig's immune systems, and it is done at around 12 or 13 weeks old. The second injection is done 4 weeks after the first one, and at least 4 weeks before slaughter, and inhibits testicular function. So the animal behaves and grows similarly to an entire male until the second injection. So these 2 graphs represent the number of mounting and the number of aggression in 3 different groups of pigs. The first group of pigs were entire males, the second one were immunocastrated males, and the third one were surgical castrated males. They evaluated 2 periods at week 17 and week 21. So after the first injection of the immunocastration and after the second injection of immunocastration. So as you can see, the immunocastration after the second dose reduced totally sexual behavior and aggression. So after the second dose, before the first dose, the males behave almost as entire animals. Immunocastrations is also associated to an increase of subcutaneous fat, which is good for meat quality, an increase of also of intramuscular fat, and as we just saw, a decrease of aggression and mounting events. Apparently, the average daily gain appears to compensate vaccine cost. However, there is still a strong response and lack of acceptation from consumers and slaughterhouses in many countries. But we can say that some countries, as Belgium, has opted for immunocastrating animals and now have 15% of their male production immunocastrated. So for sure, from a welfare point of view, the EU declaration has many positive benefits. However, there is also, as we just saw, many serious bottlenecks that are summarized below. For surgical castration with analgesia and anesthesia, there is an extra cost, which is not always paid by the consumer. There is an extra work at farm. It is time consuming. And also, more importantly, there is a lack of agreed and practical anesthesia and analgesia protocols. The raising of entiremes has serious welfare issues and still is, in many countries, not accepted from many slaughterhouses because of the damage on the carcasses and the incidence of blood taint. However, many recent advances and innovations are dealing with those problems. Immunocastration has increased in some countries, but it's still lack of market acceptance. And in the majority of countries, there is no financial support to farmers for more welfare-friendly practices. But there is a lot of advances in this field. You can find already available online the report from the Castration Consortium. Also, there is the second progress report from the expert group on ending surgical castration of pigs, which is also available. And finally, now to conclude, we can say that the deadline of the 3rd January 2012 is not met in most countries. That many progress has been made. There is less male pigs castrated without anesthesia and analgesia. There is an increased use of analgesia. Entire male production and immunocastration has gone up in some countries. Still, there is a urgent need to develop effective and feasible anesthesia and analgesia protocols. Finally, the goal is to find practical and affordable solutions accepted by the market. So we thank you very much for attending this PowerPoint presentation. And now we will just start the chat discussion. So feel free to comment, to ask. We will all be available now online.